5 bedtime drinks that may support healthy blood sugar overnight after age 60. Part 1. You've checked your blood sugar before bed. It looked fine. Then you woke up the next morning and somehow it was higher. You didn't eat. You didn't snack. You didn't break your diet. So what happened? Most people assume that blood sugar only responds to food. But what if I told you that some of the biggest influences on your morning blood sugar happen even when you're asleep? Today, I'm going to show you 5 bedtime drinks that may help support healthier blood sugar levels overnight. One comes from a common kitchen ingredient. One surprised me when I reviewed the research. One may help because of what it does for sleep. And the final drink costs almost nothing. Yet, many adults over 60 overlook it completely. Stay with me, because by the end of this video, you'll understand why your morning blood sugar can rise even when you think you've done everything right. I'm Dr. Lee. I'm a gastroenterologist. And for more than 40 years, I've helped patients better understand what's happening inside their bodies. If you're concerned about blood sugar, healthy aging, your kidneys, or your long-term health, you're in the right place. Let's get started. A few years ago, a patient came into my office frustrated. I call her Margaret. Margaret was 71 years old. She was trying hard, walking most days, taking her medications, watching what she ate. Yet every morning, her blood sugar seemed higher than expected. One day she looked at me and asked, "Dr. Lee, what am I doing wrong?" The answer surprised her, and it may surprise you too. Because one of the biggest factors affecting your morning blood sugar happens while you're asleep. Before we talk about the drinks, there's something important you need to understand. It's called the dawn phenomenon. Most people have never heard of it. Think of your body preparing for the day before you even wake up. During the early morning hours, your body releases hormones designed to get you moving. These hormones signal your liver to release stored glucose into the bloodstream. Think of it like warming up your car engine before pulling out of the driveway. For someone with healthy insulin function, that process is usually well controlled. But for someone with insulin resistance, prediabetes, or type 2 diabetes, that morning rise can become much more noticeable. That's why so many people wake up confused. Their blood sugar looked reasonable before bed, yet higher in the morning. Now here's something fascinating. Researchers have learned that blood sugar isn't controlled by food alone. Sleep matters, stress matters, hydration matters, even your body's internal clock matters. That's why what happens before bedtime can trigger a bigger impact than many people realize. Now, before we get to the first drink, I want to make something very clear. None of these drinks are a cure. None of these drinks replace medications prescribed by your physician. Think of them as tools, small habits that may support healthier blood sugar management as part of an overall plan. Let's start with drink number 5. Drink number 5 is apple cider vinegar water. You've probably heard about apple cider vinegar, but maybe not for this reason. Researchers have studied whether vinegar may help support fasting blood sugar levels and insulin sensitivity. One study published in Diabetes Care Journal found improvements in fasting glucose levels among certain participants who consumed vinegar before bed. Researchers believe the acetic acid found in vinegar may help slow digestion and improve how the body responds to insulin. Let me explain that simply. Think of insulin as a key. Its job is to unlock the doors of your cells so sugar can move out of your bloodstream and be used for energy. When insulin isn't working efficiently, more sugar remains in the bloodstream. Researchers believe vinegar may help support that process. For some individuals, if you'd like to try it, use 1 or 2 teaspoons mixed in a large glass of water. Always dilute it. Never drink it straight. And if you're taking diabetes medications, insulin, or have kidney disease, discuss it with your physician first. Now, before we move on, I want to tell you about one of the biggest bedtime blood sugar mistakes that I see. And surprisingly, it's not dessert. It's not bread. It's not pasta. In fact, most people making this mistake believe they're making a healthy choice. We'll come back to that in a few minutes. Because one of the drinks later on this list connects directly to that mistake. Now let's move to drink number 4. Drink number 4, chamomile tea. Most people think of chamomile tea as a sleep tea. And honestly, that's why many people drink it. But researchers discovered something interesting. Several studies have reported improvements in fasting blood sugar and glucose-related markers among people who regularly consumed chamomile tea. Part of the benefit may come from compounds naturally found in the tea. Part may come from improving sleep quality, and sleep and blood sugar are more connected than many people realize. 1 cup about 30 minutes before bed. Unsweetened, no sugar, no honey, just the tea. Now here's a statistic that stopped me in my tracks. According to the CDC, approximately 96 million American adults have prediabetes. Nearly 80% don't know they have it. Think about that. Millions of people are walking around with elevated blood sugar. They feel completely fine. No pain, no symptoms, no warning signs. That's one reason blood sugar problems often go unnoticed for years. Now, before we move on, let me ask you something. Have you ever checked your blood sugar first thing in the morning and wondered why it was higher than it was the night before? If that's happened to you, you're not alone. And that's exactly why I created my free health tracker. It helps you track blood sugar, hydration, blood pressure, medications, and daily habits in one place. Because when you start tracking patterns, you often discover things you never noticed before. You'll find the free download linked below. Let's move now to drink number 3. And this is where things start getting really interesting, because most people have never heard of using this next drink for blood sugar support. Part 2, drink number 3, Fenugreek tea, the one that surprises almost everyone. Most people know fenugreek as a cooking spice, not a bedtime drink, but researchers have been studying it for years. One reason is the fiber it contains, a type of soluble fiber called galactomannan. As a gastroenterologist, I find this especially interesting because soluble fiber can slow how quickly glucose is absorbed in the digestive tract. Think of it like a speed bump. Instead of sugar rushing into the bloodstream all at once, it slows the process down. Several clinical studies have been found that improvements in fasting blood sugar among people consuming fenugreek regularly. Now let us tell you the rest of Margaret's story. Remember Margaret, the patient I mentioned earlier, 71 years old, frustrated with her morning blood sugar readings? After reviewing her evening routine and discussing options with her physician, she made several changes. She improved her hydration. She paid closer attention to her evening eating habits, and she began drinking fenugreek tea regularly. Over the following weeks, her morning numbers started improving. Not overnight, not dramatically, but consistently. And that's important. The tea wasn't the entire reason. It was one piece of a larger strategy. That's how most health improvements happen. Several small changes working together. Now, can I tell you something? For years, I dismissed one of the remaining drinks on this list. I honestly thought it was another wellness fad. The kind of thing that gets promoted online with lots of promises and very little science. Then I started reviewing the research, and I changed my mind. And that doesn't happen often. Quick question. Which of the remaining drinks do you think has the strongest research behind it? Turmeric or plain water? Most people guess wrong. Keep your answer in mind. We'll come back to it. But first, I need to show you something that may even be more important than the drinks themselves. What not to drink before bed, because sometimes when you remove what you remove matters just as much what you add. Let's start with fruit juice. I know what you're thinking. It's fruit. How bad can it be? The problem is that many fruit juices contain as much sugar as soft drinks, sometimes more. And unlike whole fruit, the fiber has been removed. That means that the sugar enters the bloodstream much more quickly. Let's talk about sweet tea. Many people switch from soda to sweet tea because it sounds healthier. But your bloodstream doesn't care where the sugar comes from. Sugar is sugar. And large amounts before bedtime can work against healthy blood sugar management. The third one surprises people. Sports drinks. Unless you're exercising intently before bed, most people simply don't need them. Many sports drinks contain significant amount of added sugar. I had patients remove a single sugary bedtime beverage and notice meaningful improvements in their morning glucose readings. But because they found a miracle, because they removed the problem, remember the bedtime mistake I mentioned earlier. This is it. Many people unknowingly drink large amounts of sugar before bed while believing they're making a healthy choice. Now let's get back to our countdown. The drink I used to be skeptical about, drink number 2. Warm turmeric milk, also called golden milk. When I first heard some of the claims surrounding turmeric, I wasn't convinced. Then I started reading the research. Turmeric contains a compound called curcumin. Curcumin has been extensively studied for its anti-inflammatory practices. Why does that matter? Because chronic inflammation may contribute to insulin resistance. And insulin resistance is one of the major drivers of elevated blood sugar. Think of insulin resistance like a rusty lock. The key still works, but it doesn't work as smoothly as it did. Researchers have found that curcumin may help support healthier insulin function and glucose control. Now here's the important detail most people miss. If you're making golden milk at home, add a small pinch of black pepper. Black pepper contains a compound called pepperine. Pepperine dramatically improves the absorption. Without it, your body absorbs much less. I usually recommend unsweetened almond milk or another unsweetened milk alternative. Just make sure you're not adding sugar because that defeats the entire purpose. Now I want to pause here for a moment because I know some of you watching have been working hard. You've changed your diet. You changed to walking to now starting to walk. You've cut back on sweets. You've made real efforts to improve your health, and your numbers still aren't where you'd like them to be. If that's you, I want you to hear this. Managing blood sugar after 60 is often more challenging, not because you're failing, not because you're doing something wrong, but because the body's response to insulin naturally changes with age. That's physiology. And understanding that helps you focus on the things we can actually control. Now, before I reveal the final drink, let me share something fascinating. Researchers have documented elevated blood sugar levels in people who hadn't eaten anything at all. No snack, no dessert, no midnight meal. The body produced glucose on its own. That's how powerful sleep, stress, inflammation, and hydration can be. Sometimes you're even eating. It's what your body thinks is happening. And that brings us to the final drink, the simplest drink on the entire list, the one most people actually overlook, and the one with stronger science behind it than many people realize. Part 3, drink number 1, water. I told you this one would surprise some people. Plain water. No supplement, no special ingredients, no fancy label, just water. And yet, for many adults over 60, it may be one of the most overlooked factors affecting morning blood sugar. Let me explain why this actually happens. As we age, something interesting happens. Our sense of thirst becomes less reliable. Think of it like the fuel gauge in your car. When you're younger, the gauge works well. The body sends clear signals when it needs fluids. But as we get older, these signals often become weaker. That's one reason many older adults become mildly dehydrated without realizing it. Not because they're careless, not because they're doing anything wrong. Their body simply isn't sending the same signals. Now here's where the science gets interesting. When hydration develops, the body releases a hormone called vasopressin. You don't need to remember that name. Here's what matters. Vasopressin helps the body actually conserve water. But researchers have also discovered that it can signal the liver to release additional glucose into the bloodstream. Think about that. You're not eating sugar. You're not drinking sugar. Yet, your body may still be producing more glucose. That's one reason hydration matters far more than most people realize. And it may help explain why some people wake up with higher than expected blood sugar despite eating well the day before. Now, I'm suggesting you drink a gallon of water. I'm not suggesting that you drink a gallon of water before bed. Please don't do that. You'll spend the entire night making trips to the bathroom. Instead, consider a moderate glass of water about 30 to 60 minutes before bedtime. And before anyone asks, because I know the question is coming, Dr. Lee, should I drink warm water or cold water? Honestly, I get that question all the time. My answer? Don't overthink it. Warm water, cold water, room temperature water. The most important thing is staying hydrated. Personally, I tell patients to choose whichever temperature feels most comfortable and helps them build a consistent habit. Enough to support hydration, but not so much that it disrupts sleep, because good sleep remains an important part of the equation. That's why many people are surprised when they learn that one of the simplest drinks on this list may also be one of the most important. Let me ask you something. If I had asked you at the beginning of this video which drink has some of the strongest science behind it, would you have chosen water? Most people don't. Most people look for the complicated answer, the expensive answer, the trendy answer. Yet, sometimes the simplest answer is sitting right in front of us, and water is a perfect example. Quick review. Let's quickly review all 5 drinks. Number 5, apple cider vinegar water. 1 to 2 teaspoons diluted in a large glass of water. Number 4, chamomile tea, a relaxing bedtime tea that may support both sleep quality and blood sugar management. Number 3, Fenugreek tea, a unique source of soluble fiber that may help slow glucose absorption. Number 2, warm turmeric milk, especially when combined with a small pinch of black pepper to improve absorption. Number 1, plain water. Simple, affordable, and often overlooked. One final lesson from 40 years in medicine before we finish. I want to share something I've learned after more than 40 years of caring for patients. The healthiest patients I've known weren't necessarily the ones with perfect genetics. They weren't always the ones taking the newest medications. And they certainly weren't chasing every health trend that appeared online. The people who consistently did the best were the people who paid attention. They learned what worked for their body. They noticed changes early. They stayed engaged in their health. And over time, these small actions added up. I watched patients improve blood sugar, improve blood pressure, lose weight, sleep better, and feel better. Not because they found one magic solution, but because they became consistent with the basics. And that's exactly why I created my free health tracker. Not because a tracker changes your health, but because awareness changes behavior. And behavior actually changes outcomes. The tracker helps you to monitor blood sugar, blood pressure, hydration, medications, symptoms, the daily habits, and people are surprised by the patterns they discover after just a few weeks. You'll find the free health tracker linked below in the description. My challenge for you, and if you've made it this far, I want to challenge you to do something simple. Don't try all 5 drinks tonight. Pick one, just one. Try it consistently for the next 2 weeks. Pay attention. Track what happens. Notice how you feel. Notice your morning numbers. Notice your energy, because healthy aging rarely comes from one dramatic decision. It usually is the result of small decisions repeated consistently over time. A better bedtime routine, a healthier beverage choice, better hydration, a daily walk, a little more sleep. Those choices may seem small today, but over months and years, they add up. I've watched it happen thousands of times throughout my career. The human body has an incredible ability to respond when we start giving it what it needs. So start where you are, use what you've learned, and take one small step today. If you found this video helpful, subscribe and join our community. Every week I share practical health information designed to help you stay healthier longer. And if you like help tracking your progress, don't forget to download the free health tracker below. I'm Dr. Lee. Thank you for watching. Take care of yourself, and I'll see you in the next video. Before you go, watch this next 7 morning habits that trickle your stroke risk. Are you doing them? One of those videos may answer a question you didn't even know you had. Thank you. I'm Dr. Lee. God bless you.